Pituitary hyperplasia from primary hypothyroidism. Definition: it is the increase in the cellular content, volume, and weight of the pituitary occurs psychological during pregnancy as a result of the increase in the circulating estrogen index.
Hi, this is Tom from ZeroToFinals.com. In this video I'm going to be talking about hypothyroidism. You can find written notes on this topic at ZeroToFinals.com/hypothyroidism or in the endocrinology section of the Zero to Finals medicine book. Let's jump straight in. Hypothyroidism is the term used to describe inadequate output of thyroid hormones by the thyroid gland. There's a few different causes. The most common cause of hypothyroidism in the developed world is Hashimoto's thyroiditis, and this is caused by autoimmune inflammation of the thyroid gland, so the body's immune system attacking the thyroid gland. It's associated with antithyroid peroxidase or anti-TPO antibodies, and also with antithyroglobulin antibodies. Initially it causes a bit of a goiter, after which there's atrophy of the thyroid gland as the hypothyroidism sets in. Iodine deficiency is the most common cause of hypothyroidism in the developing world, and this is because iodine is essential for the production of thyroid hormones. Iodine is added to foods like table salt to prevent iodine deficiency and to prevent hypothyroidism. Hypothyroidism can also occur as a result of treatment for hyperthyroidism. So all the treatments for hypothyroidism have the potential to overshoot and cause hypothyroidism. So these are treatments like carbimazole, propylthiouracil, radioactive iodine, and of course thyroid surgery. There are also medications that can cause hypothyroidism. Lithium inhibits the production of thyroid hormones in the thyroid gland, and so can cause a goiter and hypothyroidism. Amiodarone interferes with the thyroid hormone production and metabolism, and usually it causes a hypothyroidism, but it can also cause a thyrotoxicosis. There's also secondary causes of hypothyroidism, or central causes, and this is where the pituitary gland is failing to produce enough TSH. And this is often associated with a lack of other pituitary hormones as well, such as ACTH, and this is called hypopituitarism. And it has quite a few different causes, and these causes can be tumours of the pituitary gland, infections in that area, vascular pathology, such as something called Sheehan syndrome, where you get pituitary necrosis after massive blood loss during childbirth, and radiation therapy to the pituitary gland. So how do patients with hypothyroidism present? Well, they can present with weight gain, fatigue, dry skin, coarse hair and hair loss. They can have fluid retention, so they can develop edema or pleural effusions or ascites. They can have amenorrhea, so the periods stop, and it can slow down the bowels and make them very constipated. So when you suspect hypothyroidism, how do you investigate them? Well, firstly, you would do a TSH, find that the TSH is abnormal, and then do T3 and T4 levels. In primary hypothyroidism, this is caused by a thyroid gland insufficiency. So the thyroid hormones like T3 and T4 will be low, and the TSH level will be high because there's no negative feedback to the pituitary gland. So the pituitary produces lots of TSH to try and get the thyroid working again. In secondary hypothyroidism, and that results in a low production of TSH. So TSH will be low and the thyroid hormones will be low. How do we manage hypothyroidism? Well, it's quite straightforward. We simply replace the thyroid hormone that isn't there with oral levothyroxine. So we give them oral thyroid hormone in the form of levothyroxine. Levothyroxine is synthetic T4 and it metabolizes in the body to T3. So you get T4 and T3 from this one medication. The doses are titrated until TSH levels are normal. So when you start levothyroxine, and the thyroid hormones will be low. How do we manage hypothyroidism? Well, it's quite straightforward. We simply replace the thyroid hormone that isn't there with oral levothyroxine. So we give them oral thyroid hormone in the form of levothyroxine. Levothyroxine is synthetic T4 and it metabolizes in the body to T3. So you get T4 and T3 from this one medication. The doses are titrated until TSH levels are normal. So when you start levothyroxine, initially measure the TSH levels monthly until the TSH level is stable, and then once stable it can be checked less frequently unless the patient becomes symptomatic. So if the TSH level is high, you know the dose of levothyroxine is too low, so it needs to be increased, and if the TSH level is low, you know that the dose of levothyroxine is too high and it needs to be reduced. So thanks for watching. I hope you found this video helpful. If you did, don't forget there's plenty of other resources on the Zero to Final.
Applications in nursing. Vital signs control, correct administration of medications,
In this video, I'm going to talk about thyroid hormone feedback. So let's look at the mechanism by which thyroid hormone is released. The hypothalamus releases TRH onto the pituitary thyrotrope cells. If you don't know what these words mean, have a look at the thyroid hormone control video. The thyrotrope cells then release TSH into the bloodstream. And then it diffuses out of the bloodstream into the thyroid gland. The thyroid gland is then induced to release thyroxine, which is T4. It also releases T3, but that's not important here. Now T4 enters the bloodstream and feeds back onto the pituitary and onto the hypothalamus, and it reduces the release of TSH and TRH respectively. Now this has important implications for the diagnosis of thyroid problems, as it's possible to diagnose the location of a problem depending on the blood levels of thyroxine and TSH. So I'll draw up a table with each of the possible situations. So if thyroxine is high, this is what we call hyperthyroidism. And if thyroxine is low, this is what we call hypothyroidism. If thyroxine is high and TSH is high, because we know that thyroxine should be suppressing the release of TSH, then there must be a problem in the pituitary, which means that this feedback mechanism doesn't work. Therefore, the problem must be in the pituitary. If thyroxine is low but TSH is high, then there must be a problem in the thyroid, which means that it's not responding to the high levels of TSH. If TSH is low and thyroxine is high, then it must be also a thyroid problem because it's not responding properly to the TSH and it's still releasing high levels of thyroid hormone. And if thyroxine is low and TSH is low, because TSH should be high when thyroxine is low, then the problem must be in the pituitary, as the pituitary is not responding to the feedback action of thyroxine. And that's an overview of thyroid hormone feedback and how it can be used in clinical diagnosis.
Pros and cons. Pros. It is not operated surgically. This disease is treatable if the patient takes his medication correctly. He will have improvement of the picture. Cons. Severe headache, dry skin, weak and short size.
Hi, I'm Dr. Brian Roadhouse, and today what we're going to talk about is primary hypothyroidism. There are 6 patterns of thyroid low function or dysfunction or hypothyroidism. And primary hypothyroidism, if you have this, you're probably not watching this video. It's the least occurring of the 6 patterns of thyroid dysfunction. So when you go in the doctor and they don't do all the tests that we do to fully evaluate your thyroid, they might diagnose you with primary hypothyroidism. If you have primary hypothyroidism, you're going to go to the doctor, they're going to give you the medicine, they're going to say, try this medicine and let's check back with you in a certain amount of time. If you are primary hypothyroidism, you're going to go back to the doctor and go, you know what, I'm feeling better, I'm not all the way fixed yet, but I'm on the way to recovery. So I go, okay, well let's just keep this way since it's working for you, and we'll go ahead and check again and say in 3 months. They come back in 3 months and they're continuing to improve. That's primary hypothyroidism. Most of the patients who come in have already tried that and it didn't work. Now, you might have been improperly diagnosed with primary hypothyroidism. They might have given you the thyroid hormone and you started to get some improvement. Because the thyroid hormone, every cell in the body has receptors for hormones. And so they're going to give you this flood of this synthetic hormone, and it might make you feel better. It might start, getting some improvement. But as the pituitary evens things out, all of a sudden the symptoms start coming back. So if you've been diagnosed primary hypothyroidism, you took the medicine, it didn't work, or you took it and it worked for a while, and then all of a sudden the symptoms are coming back, you don't have primary hypothyroidism. I have patients coming into my office on thyroid hormones 15 to 29 years, and they're not getting any better. If you have that, the thyroid hormone works if you are primary hypothyroidism. Okay? So if you're taking the medicine and maybe some of the symptoms improve, but you still have the overwhelming number of thyroid symptoms, you need to get into the office so we can evaluate you properly, do all the tests we need to do, and find out what's going on. Now, some patients can have primary hypothyroidism because it's one of the 6 patterns of thyroid dysfunction, but they could also have an autoimmune problem. So they take the medicine, but they're still not getting any better. That's why we do the test. If you don't do the test, you don't know what's wrong with the patients. We're very thorough in the lab test, and it's going to let us know what your problem is. Not everybody is a candidate for our program. It's for only 10% of the population. It's usually patients who have tried everything, nothing's worked, they've tried the medicine, they've tried natural methods, and it didn't work. I can guarantee you no one has tested your thyroid like we will, and we'll get to the bottom of this. So if you're still having symptoms and you're tired of them and you want to get back to feeling good again, give us a call, 918-481-2770, and let's get you properly examined. Let's do a consultation on it, and let's find out if you're a candidate for our program. If you are, let's try to get your life back. Thank you.
Issue applied in Ecuador. In Ecuador, recent data showed that the hypothyroidism occurs about 8% in the adult population, and the congenital hypothyroidism has a relatively high incidence times 1 and 1,500 births.
Hello, I'm Siobhan Pillard. I'm a pediatric endocrinologist at Mayo Clinic Children's Centre, and today I'd like to talk to you about hypothyroidism. To have a better understanding of hypothyroidism, I think it's important that you understand what the thyroid gland does and how it's regulated. So the thyroid gland is a gland that sits here in the neck in front of the airway, and it's shaped like a butterfly. And it makes a hormone called thyroid hormone, or T4, is what we call it for blood tests. And the function of thyroid hormone, or T4, is to regulate the speed of the cells that the body is working. So if there's too much T4, that we call that hyperthyroidism, everything in the body is sped up. So you have lots of energy, you have a shake potentially, you have fast heart rate, you have a lot of sweating, you lose weight easily, and it's not very healthy. On the other hand, if you have not enough thyroid hormone, we call that hypothyroidism, everything is slowed down. And when things are slowed down, you feel very tired, your heart rate is slow, you may feel colder than you should feel, want to wear extra jackets in the summertime, you often have dry skin, dry hair, or you may have constipation. So it's important that the body really functions at the right speed, neither too fast nor too slow. And because that is such an important function, the body has the thyroid regulated not just by itself, but by a higher body called the pituitary gland. And the pituitary gland sits in the brain, in the center between the eyes, just behind the eyes and in the center. And the pituitary gland regulates lots of glands around the body, not just the thyroid gland. How it regulates things is that the pituitary gland is what tells the thyroid gland what to do. And how it does this is by secreting a hormone called thyroid stimulating hormone, or TSH for short. Under the influence of this TSH, the thyroid gland makes thyroid hormone. The pituitary gland is constantly aware of how much thyroid hormone there is in the body, and we call that a feedback loop. So the pituitary gland knows how much stimulation the thyroid gland needs by recognizing how much thyroid hormone there is in the system. So what happens in hypothyroidism, it can be caused by two separate events. Either your thyroid gland gets sick, and that's the most common situation by far. The thyroid gland gets sick, we call that primary hypothyroidism. If the thyroid gland is sick, it doesn't make enough thyroid hormone, so we get a low T4 level. Because we have a low T4 level, the pituitary gland recognizes that and says, hey, thyroid, wake up, make more hormone, and increases the amount of stimulation it's given. So in primary hypothyroidism, we have a low T4 because of a sick thyroid gland, which results in the pituitary gland shouting louder at the thyroid and increasing the TSH. And that can be confusing for people because we talk about hypothyroidism, people know that it's underactive, and yet we talk about a high blood test. This is why. It's because it's a high TSH. The second situation where we can get hypothyroidism is if your pituitary gland itself is sick. If your pituitary gland itself is sick, it isn't going to make the TSH, and so even a healthy thyroid gland can't respond because it's not being told what to do, and so you have a low T4 level. That's much less common. We call that secondary hypothyroidism. Whether you have primary hypothyroidism or secondary hypothyroidism, the treatment is the same. what we do as physicians, as providers, is we give you the replacement. This is what you need, the T4, and we have a really good chemical substitute for that. It's called levothyroxine, and we give you the levothyroxine. It's a one-stage pill, and then we figure out how you're doing based on your symptoms, but also based on measuring these two blood tests. And we can tell that very easily if we have given you the right amount of medication by checking blood tests. It doesn't take very frequent monitoring. We check it more frequently in children because they're growing and their doses need to be adjusted more frequently. And then in adulthood, generally, people only need to have their thyroid blood tests checked once a year. For the most part, primary care providers, whether they be pediatricians or family doctors, are comfortable looking after hypothyroidism once the initial diagnosis has been made and once people have started on therapy.
Conclusion. Primary hypothyroidism due to the decrease in thyroid hormone. HRT levels are increasing, generating and increasing in TSH. In addition, hyperplasia of the leukotropic cells occurs and, as a consequence, hyperprolactinemia.
FlashMed. Did you know? In primary hypothyroidism, the thyroid gland is unable to produce sufficient amounts of thyroid hormone. In secondary hypothyroidism, the thyroid gland is normal, but it receives insufficient stimulation because of low secretion of thyroid-stimulating hormone, TSH, from the pituitary. FlashMed, video flashcards.